Garrett, next slide, please. Thank you. So as you've heard of a few times throughout the last 2 days at our conference, this is a program out of the Maternal and Child Health Bureau, HRSA's Maternal and Child Health Bureau. Oh, we're having some tech issues. Could you hit next slide? And our mission is to improve the health and well-being of America's mothers, children, and families with a vision for an America where all mothers, children, and families are thriving and reach their full potential. Next slide, please. Thank you. And the emergency medical services for children, our legislative mandate, our authorizing legislation, is to support a program of demonstration projects for the expansion and improvement of emergency medical services for children who need treatment for trauma or critical care. So this concept of expansion implying kind of expanding access to emergency medical services for children. And this concept of improvement is improvement in quality of emergency medical services for children. And the EMSC program, as we know, works across the full continuum of emergency care for children. That's pre-hospital EMS and hospital emergency departments. Next slide. So over time, the budget for the EMSC program has increased from $2 million to over $22 million per year to support emergency medical services for children across states and jurisdictions. As you can see here, this was our FY 2021 funding at $22.3 million. And you can see amidst the other maternal child health bureau programs, kind of where EMSC is situated as far as allocated appropriations. And I know that Dr. Warren yesterday during the plenary session discussed the President Biden's FY22 budget, which proposes a $5.8 million increase for EMSC. So as we reflect on our appropriations, our mission, it's important that we're considering the work that we're doing and how we evaluate and assess progress and guide our program moving forward. Next slide. Next slide, please. Thank you. The EMSC program invests across a broad spectrum of different programs. So we have our state partnership, PCARN, Targeted Issues, the EMSC Data Center, and the EMSC Innovation Improvement Center, of which many of those in participation today are you're part of that. Next slide. And our programs work dynamically, iteratively, and collaboratively across these program domains. So integration, innovation, evidence generation, quality improvement, accountability, all improving systems of care and infrastructure for children seeking emergency medical services across the country. Next slide. So the purpose of evaluation. So the purpose of this evaluation was to perform an impact evaluation of the EMSC program portfolio. Our presenters will talk a little bit about the specific questions that we asked in this evaluation, which guided the evaluation. And so a few things that independent evaluation can do. It can increase public confidence, verify fiscal responsibility, organizational health, accomplishments, and resource allocation. And very importantly, it supports continued growth and adaptive programming to meet our goals. Next slide. So I'm very excited to introduce our speakers for today from Insight's team, who will be presenting on their preliminary findings of the evaluation for the Emergency Medical Services for Children program. We have Dr. Laurie Coots, Daras, who's the Director of Health at Insight Policy Research. She's a senior health services researcher and project director with 20 years of experience. Dr. Coots Daras has worked on numerous contracts for the federal government, primarily for the Centers for Medicaid and Medicaid Services, where she led quantitative analysis using Medicare claims data to assess risk standardized hospital readmission rates for quality reporting and value-based purchasing programs in post-acute care. She's currently supporting HRSA with the evaluation of the Emergency Medical Services for Children program as a quantitative advisor. I'm happy to introduce Sarah Lifsey, who is a senior manager at Atlas Research and has worked in public health policy and evaluation since 2006. Sarah Lifsey is an accomplished qualitative and quantitative researcher with expertise collecting, managing, and analyzing large data sets, including program outcome data, key informant and stakeholder interviews, focus groups, and public data. She has a broad understanding of issues relating to population and community health with a focus in maternal and child health. Thank you so much. And I'd like to move on and present the slides for our speakers.
Thanks, Laura. So I think while we're getting the slides, David's getting the slides up and running in the background, I'm going to go ahead and start. Really pleased to be here this morning presenting an overview and preliminary findings on behalf of the evaluation team for the EMSC program. So our team is led by Insight Policy Research, and we have research partners at Atlas Research, and we're excited to share some of our results and also have a nice dialogue this morning and get your input. On the next slide, we have an agenda of the presentation. And so as I said, we plan to give an overview of the evaluation, the goals and the research objectives. The majority of the presentation, we want to be reviewing the preliminary findings with you. And as I said, at the end, we'll look forward to engaging and getting your feedback and answering any questions that you might have. So on slide 3, I'm going to begin with the evaluation goals, which Laura laid out very nicely. These align with what the legislation requires. So not surprisingly, the evaluation is looking at assessing the extent to which the program and the portfolio are expanding and improving access to emergency medical services for children. On the next slide, the MCHB team tasked our research team with assessing the impacts of the entire portfolio, which, as you know, refers to a rather diverse set of activities. So often we think about this concept of, are we moving the needle, and what is the impact overall, and how do you measure that? So that's that is what we have been working on for the last couple of years. On the next slide, we lay out some of the primary evaluation questions to give you a sense more specifically at what we're looking at. So we developed several questions that guided the research, notably understanding the types of changes and outcomes that have occurred over time, trying to understand what the relationship is between outcomes and the EMSC program activities. What is the context surrounding the program, which, as you know, was a very complicated context over the last year and a half. And then lastly, what factors influence the implementation. On the next slide, I wanted to share kind of how we think about this as program evaluators. So we developed a logic model, and I'm sharing it here not because I think you can read the words, I know you can't, but just to sort of share conceptually how we think about this when we evaluate federal programs. To illustrate this, first we kind of start on the left side with the program inputs. So in this case, the grant programs that are supporting activities like those addressing access and improving services, educating the workforce, et cetera. And then we look at the relationship between those inputs with the activities. And some of these specific activities might be increasing the number of recognized hospitals, training EMSC personnel, developing research, evidence, and products that contribute to the guidelines, and then how that translates into the outcomes. I think I kind of combined a couple of the columns, but just to sort of, lay out conceptually how we think about things. And so some of the specific outcomes that we have been thinking about with regard to the evaluation include a variety of short, intermediate, and long-term outcomes at different levels. So the levels might be at the individual clinician or provider level, or at the institutional or systems level types of outcomes. So just wanted to kind of share that because it's a different, often, when folks are providing services from a clinical perspective, you have kind of the one-on-one, but we're sort of looking big picture. So thought that might be a helpful way to orient us as we go into the specific research activities that we've engaged in. On the next slide, this is slide 7, we have laid out here the major components of our mixed methods approach. So we included in-depth interviews with key informants. We conducted a bibliometric analysis. We performed a document review of the performance narrative reports. And then we analyzed some more quantitative secondary data sources, such as the performance measures for EMSC, and then had a very limited look at the registry data from NEMSIS. So I'm going to hand it off now to my colleague, Sarah Lifsey, who's been leading the work from Atlas, and she'll be presenting the preliminary findings from the first 2 methods. So we can move to the next slide and hand it off to Sarah. Thank you.
Great, thanks, Laurie. So I'm going to first present the results of our key informant interviews, which were intended to obtain insights from both grantees and program partners about the context and the program activities, particularly over the most recent year. We developed in-depth interview protocols, and we interviewed state partnership grantees, non-state partnership grantees, and external stakeholders. This all took place during April and May of 2021. We produced transcripts of these interviews, and we used a qualitative analysis software called In Vivo to look at these common challenges, facilitators, key successes, partnerships, and contextual factors. We can go on to the next slide. So our first key finding from these interviews is that EMSC funded grantees have achieved key successes over this past year, despite COVID-19, and have continued to make progress on grant goals. These successes included building partnerships, holding trainings for practitioners, increasing dissemination, growing and supporting pediatric emergency care coordinators, the development of new research activities, and just continuing to field and fund research in the field. One overarching accomplishment from this past year that spans categories is adaptations made to COVID-19. The folks that we talked to felt that keeping projects moving, even if it involved going to virtual formats, relaxing timelines, or otherwise staying flexible, was a key success in itself. Go to the next slide. Our second key finding is on the facilitators that supported grant activities. And this included support from EMSC programs and resources and partnerships built by grantees. The EMSC resources and support included the grant funding itself, technical assistance from the HRSA project officers, technical assistance from entities like NEDARC and EAIC. Another key facilitator was the partnerships built by programs and grantees. These collaborators included federal partners, national organizations, other grantees, other researchers, and of course, hospitals and EMS agencies, among others. The benefits to these partnerships included information sharing at meetings and conferences, collaborating on research and on data collection and sharing, disseminating materials, and participating in planning meetings and advisory boards across these programs and partners. At the national level, stakeholders talked about supporting the EMSC program through disseminating EMSC materials to their membership, adding endorsements and credibility to EMSC products, and otherwise benefiting from synergy in projects and goals between the national organizations and EMSC and its partners. Next slide. So our third key finding is on challenges and barriers. And this includes lack of time, turnover among key staff or key partners, and the need for more funding and resources. Some of these challenges were a direct result of COVID-19, like challenges related to adapting to remote work and the cancellation of in-person meetings and conferences and site visits. Other challenges were worsened by COVID-19, such as delays in data collection, loss of staff to COVID-19 related details, and partner and collaborator lack of time due to these emerging goals and pressures from COVID-19. Some other challenges were ongoing across grant years, the need for more funding, for more staff to support project activities, and the challenges caused by staff turnover and the resulting loss of institutional knowledge. For the program as a whole, interviewees noted a need for publicity and branding for EMSC, and that the program is not as well known as it should be, particularly among legislators and policymakers. Next slide. So our final key finding from the key informant interviews is that the grants in the EMSC program as a whole achieved impacts beyond their stated aims. So these are impacts that go beyond, just working towards the goals of the grant, specific research projects or trainings or products. Some of these larger impacts that we found included growing pediatric emergency medicine research capabilities through participation in research networks and increasing the rigor of pediatric emergency medicine research. Another impact was spreading practices beyond immediate partners to hospitals and EMS agencies in other regions and even other states. And a third was just growing future leaders in research, future leaders in the state systems and future leaders on the national level in emergency medical care for children through mentorships and training. So we asked interviewees to describe the biggest positive impact of the EMSC program. And what we heard was focused in 4 areas. It's conducting research and disseminating those results, supporting the grantee programs, serving in a leadership role in pediatric emergency medicine for agenda setting and guidance, and lastly, building partnerships and conducting collaborative work with national partners. Next slide, please. The other piece of the evaluation that I'm going to give us an overview of here is the bibliometric analysis. And what we're looking to do with this was to quantify the contribution of specifically the targeted issues and PCARN research to the scientific literature. In our analysis we chose years 2008 to 2018 to account for publication lag. And we looked at metrics like number of publications, number of citations, journal impact, H-index, which I'll explain a little bit more in a minute, and contributions to guidelines. And to capture a broad set of citation data, as well as a narrower, more academic focused set of citation data, we collected data from both Google Scholar for the broad look and Web of Science for the narrower, more academic look. Both of these have their own strengths and limitations. And we also reviewed these guidelines published by national organizations during the time period to measure those contributions to the guidelines. Next slide. So the key findings here from the bibliometric analysis is that over this 10-year period, EMSC funded research really did contribute to the field. We have the targeted issues in PCARN, total number of publications here. We have the average citations per publication for both Google Scholar and Web of Science. We have so looking at the Google Scholar citation numbers, targeted issues publications demonstrated an H-index of 42, and PCARN demonstrated an H-index of 49. I did say I'd explain a little bit more about the H-index. It's basically a measure of the cumulative impact of research. An H-index of 42 means that within the portfolio of publications, 42 publications had been cited at least 42 times. Using the more conservative Web of Science citation data yields a targeted issues H-index of 29 and a PCARN H-index of 38 over this time period. These are pretty good numbers. I mean, a researcher with 20 years of experience is considered outstanding with an H-index of 40. And we did look at research on similar grant-funded publications, portfolios, and found H-indexes of 30 in one instance and 74 in another one, with that larger one being over a 20-year time period, so a longer time period than we looked at. We also looked at the contributions of two published guidelines by looking at whether those guidelines cited any of these papers that we in this program portfolio, either for TI or PCARN. We found 14 TI publications cited in 9 guidelines and 31 PCARN publications cited in 14 guidelines. So this research contributed to guidelines on a pretty wide variety of topics, including recognition of child abuse, transition of care, equipment for ambulances, fever, cardiac arrest and resuscitation, mental and behavioral health, disaster preparedness, pediatric trauma, medication safety, and pediatric readiness in general. So a pretty wide variety of topics that the research has contributed to there. We can move on to the next slide, and I'm going to hand it back over to Laurie for the other pieces of the analysis.
Excellent. Thank you so much. I I'm sure we'll have lots of questions on some of the results that you covered, and we'll plan to pick those back up at the end. I have a couple more results by research method that I'm going to share with you. The next one here is a document review. So this is where we're basically using existing data and specifically the performance narrative reports that grantees are submitting. So we'll be highlighting some findings on this slide. So we analyzed over 200 of these project documents over the period of 2006 through 2021. And then we coded these using a coding taxonomy similar to that developed for the interviews that Sarah presented using in vivo. And then we conducted some targeted analysis for this year on a couple of specific topics, some of which that we'll be sharing today. So in particular, we'll be sharing with you some of the findings related to activities that grantees have been engaged in related to health equity. And the second kind of set of results that we want to share are how grantees are using data for either self-assessment and in their own work. So if we go to, and at the bottom of the slide, you can kind of see, we want to acknowledge that like these data come from grantees. And so we really appreciate, and I know HRSA appreciates the detail that you put in there throughout, as we've been going through the presentation, we wanted to highlight what are the ways that we're using data and information that you're submitting already, and really appreciate the quality of the detail and so forth that are in those documents, because it enabled us to use it for this evaluation. So on the next slide, we're going to dig into some of the results from the document review. These boxes with the red italics are direct quotes from some of the performance narrative reports. I won't read them off, but if you want to take a look at them, we sort of anonymize the state or the grantee. But want to start with a few slides summarizing the health equity results. Overall, we learned that grantees are expanding and increasing access to educational opportunities. So you can see these illustrative quotes talking about online education, how that's helping support engaging harder to reach communities. And although COVID required more virtual education, one of the silver linings, because I think we're all looking for silver linings right now, is that actually helped facilitate engaging a more geographically diverse audience. And that may not have happened necessarily. So that might be something that, we take with us, all of us kind of into the future, is that ability to not have to travel and kind of engage people across areas. So on the next slide, I wanted to share some of the examples that we found from grantees that are increasing representation on advisory councils and building relationships that are aimed at improving access and health equity. So the couple of examples here were where we found grantees that were including tribal representatives on advisory committees in some parts of the country, or collaborating with offices of rural health. So both of those populations, tribal, rural areas, are certainly important populations to be thinking about when it comes to ensuring equity. So we have a couple of, kind of the specific quotes that we pulled from those documents to share with you today. And if we go to the next slide, we have examples of engaging rural and tribal communities to ensure care is culturally appropriate. And another example here was ensuring that rural and frontier populations, in particular EMS transport agencies, had access to pediatric restraint systems. So that's kind of a specific activity that we pulled out to better understand how health equity is being addressed. And on the next slide, we found another area that health equity was being addressed specifically is in states that focused on pediatric populations with special healthcare needs. And so some of the concrete examples that we saw grantees working on include creating websites that might guide or guides that might help families and caregivers of pediatric patients with these special healthcare needs. And on the next slide, we'll turn to some of the findings on how grantees are conducting self-assessment and how data are being used. So we found that programs share this information with advisory committees. They may create state data report cards. We found that data are being used to help clarify program objectives or priorities. Grantees also noted using data for recognition systems and to promote initiatives, strengthen gaps, and for goal setting. For example, one state indicated that they used prior year surveys to develop a brief report on state performance, which is then distributed to stakeholders. And I think that aligns nicely with some of what Sarah discussed in terms of getting some recognition for the program and all of the work that's being done. On slide 21, we wanted to share some very high level results on our final evaluation method, which was analyzing some quantitative secondary data sources. So that includes analysis of the performance measure data. And we found that, so we analyzed all the performance measure data, just highlighting a couple of things here, where we found some solid improvement on the state partnership measures for having a PEC in agencies and recognition for pediatric medical emergencies. And I think both of the progress for both of those measures, we saw improvements, and they also align nicely to other collaboratives that are going on. So I think this is a case where there has been the needle has been moving, perhaps as a result of those activities. And then wanted to just mention that this is a case where we're again leveraging data that you're collecting or supporting the collection of to better understand the program. And then finally, we did also conduct some limited analysis to understand utilization among children nationally. So using the NEMSIS data to get a sense of how, among reporting agencies, what proportion of encounters are for pediatric patients. So I think that covers kind of the main results that we wanted to share with you today. If we go to the next slide, we just have a placeholder for some discussion and feedback from you all. I'm sure you might have lots of questions because we had to gloss over a lot of the methods and kind of specifics, but I think Laura really wanted us to try and give you a big, a flavor of all of the different types of things that that we worked on, as opposed to going in depth. So I will perhaps hand it back to you, Laura, to help kind of facilitate the questions. And yes. Thanks, everyone.
Thank you so much, Laurie and Sarah, for presenting your preliminary findings on the evaluation. I do want to open it up now to a question and answer. If we have any questions from the audience, you can feel free to either unmute or you can type your questions directly into the chat box. Looks like we have a question from Sam Vance. Hi, Sam. With a potential increase in federal EMSC budget, is consideration being given to increasing funding of the state partnership grants? Thank you, Sam, for that question. And I know during yesterday's plenary session, this was something that was asked to Dr. Warren as well. And additional funding within the president's budget, additional funding to states to address critical gaps that remain for children's access to high quality emergency care and trauma is being considered, as well as states building mental health capacity for children in emergency departments. Sarah Kinsman, is there anything you wanted to add on that?
No, I think that is, hi, everybody. Nope, that's exactly true, that if we are lucky enough to be able to get this funding, it's not final yet. So we just have to wait for reconciliations back and forth. It would be focused really on our state partnerships, who've done a wonderful job over the years at what seems like a very steady budget for in a long, long time. So that would be our focus. And thank you, Laurie and Sarah. This was great. Appreciate it.
Yeah, thank you.
Any other questions from the group? Feel free to unmute. Like we have a question from Mark Minkler. Looking at the info that you received, it seems like an overall national perspective. Did you gain any insights if there was regional variations of analysis?
Yeah, that's a great question. In some ways, what we designed to do from an evaluation perspective this year wasn't aimed at assessing any regional variation. One of the areas where we did look is when we were analyzing the performance measure data. We looked nationally, where the numerator was the number of agencies that met the criteria for the measure, and the denominator was all EMS agencies, for example. But then we did look at states, and we did see some regional variation. There are definitely some states that are making more gains, I think, in some of these areas than others. But in terms of I don't have too much more to say about it, unfortunately. Just that we did see some notable differences among the performance measure data. In terms of the more qualitative data that we looked at, we didn't assess it in that way. So we don't have too much, I think, to share, except, I think we might expect that certain states are kind of well known for certain things in terms of efforts and so forth related to EMSC. But we didn't do anything very rigorous to kind of analyze regional variation. Sarah, I'm not sure if you have anything that you might add, or if you want to talk about kind of the how we identified the respondents for the interviews.
Yeah, for the interviews, we wanted to get a representation of interviewees across the United States. We wanted to make sure we included more rural areas and more urban areas, as well as just the different geographies. But because the Key Informed interviews were kind of we talked to 9 state partnership grantees and 9 non-state partnership grantees. We wouldn't have had enough responses to say, like, all right, so here's what the East Coast thinks or the West Coast thinks or anything like that, just because it was a sample of folks. And with the bibliometric analysis, of course, I was focused on the specific publication set. So that wasn't really, I know that the targeted issues and PCAR grantees are in different regions, but we didn't look at it like that. We looked at it as a whole.
Thanks for that question. And we have another question, but I also wanted to just let folks know, feel free to hop off mute and pose your questions in addition to in the chat. So Laura, do you want to review that one?
Yes, thank you, Mark. Looks like Mark has a follow-up question. So just as follow-up and along the lines of Sam's question of dollars, did any analysis differentiate successes if programs relied entirely on federal funding versus those programs who had state and local funding matches in addition to the federal dollars? Not sure you looked at this, but perhaps info in passing. So I'm happy to speak to that, Laurie, if that's
sure.
Okay.
Yeah.
I think this is a great question, and sort of some of the follow-up I wanted to make from your last quick question, Mark. I think this is a really interesting inquiry. I think this is something that we can start to look at with our current performance measure data. Are there regional variations? Is there a differentiation between states that, as you're saying, have matching dollars? We didn't look at that through this particular evaluation, but I think these are really helpful comments and interesting inquiries that I think moving forward, we will tally and think about. And we do get some of that information kind of around matching in our annual performance reports through the discretionary grant information system. So I think moving forward, this is extremely helpful. So thank you for that.
Yeah, and I think I'll just add that we did talk about this on our team. And so our colleague Rachel, who's been leading the project, was interested in exploring this ability to see how funding may vary by grantee, given, everyone kind of gets a fixed amount for EMSC, but with these supplemental funding and so forth. So it definitely is on our radar. I think that your question also hints at some of the challenges that we faced as evaluators, which is there are some rather large data limitations in particular in terms of looking at outcomes. And so as evaluators, what we always want to do is say like, okay, this activity happened, what's the outcome, back to kind of that logic model. But the outcomes are a little bit harder to measure here. And there are definitely some limitations that we encountered. And while we were eager to explore NEMSIS as helping kind of fill some of those gaps where we could look at specific patient outcomes, we had some limitations with being able to geographically identify and link the registry data with grantees. But I think that really appreciate the question and feedback, because I think that that is something that, perhaps in the future could be explored further.
Thanks, Laurie. And, as we're talking about this a little further, I mean, we didn't exactly look at matching or additional funds outside of federal dollars, but we do have some really interesting examples of supplemental awards that have been awarded, at least to the state partnerships, and advancing, concerted efforts towards increasing the number of pediatric emergency care coordinators across EMSC agencies, and how that concerted PEC collaborative and additional funds may have boost. I know NEARC has some specific, the National EMSC Data Analysis Resource Center. I know we have some folks on the call right now from there. Hey, NEARC. I know they've done some looking at some of the states that were participating in those collaboratives that did receive extra funds, and states that participated in collaboratives that didn't receive extra funds. Again, these are all additional federal dollars, but I think your point around, especially as we learn about the amazing accomplishments across our states to get additional, private foundation funding to improve, to further pediatric readiness. I think this is a really important thing for us to keep stay conscious of as we move forward for analysis. So thank you for that. Any other questions? Please feel free to unmute as well, or type into the chat box.
I wanted to also acknowledge that we have had a standing committee that's been engaged in the evaluation work, and I saw a couple of members of the standing committee, including Kate and Eddie and maybe others. So wanted to acknowledge their contributions to the evaluation as well. And we do have a couple of folks from the research team that I should have mentioned at the start, but obviously this has been a big effort. So really appreciate everyone's work and contributions, and of course the support from MCHV.
Thanks, Laurie. So I do have a question for the group that we have on the call today. So beyond our presenters, so hopefully I'm not putting too many of our audience on the spot, but I think a big part of the EMSC program, and a question we are constantly asking ourselves, is just, we have such vast partnerships that, at every level. And so how do we capture that in measurement? How do we integrate that, or ensure that we integrate that effectively into our story? So I didn't know if folks on the call, to put the audience kind of on the spot, as we're thinking about evaluation and a net impact and how we articulate the impact of the Emergency Medical Services for Children program, if any folks had any thoughts or ideas in regards to that, but also, as a consciousness that we are continuously asking that, how we did to demonstrate those really vast and those vast partnerships. It's a hard question for us to ask as well. And we do have, aspects of performance management measures that capture engagement with the advisory committee and representation on advisory committees. But, we are continuously reflecting on that. So if you have any thoughts, you can always email me at lludwig@hrsa.gov. And we're open to suggestions and ways of framing and understanding, the vast partnerships of EMSC.
I will say, Laura, the one thing that we heard in the interviews about partnerships was about not so much matching funds, as folks were talking about earlier, but about kind of contributions in kind, such as, providing space at a conference and registration for that conference to present information that would be of interest to that organization's membership that the EMSC grantee is working on, or providing access to trainers to help teach providers something specific. So I don't know if that kind of in-kind support is captured anyway, but that was an important element of partnerships that I think can be a little hard to quantify sometimes that we did here in the interviews.
Thanks, Sarah. Well, okay. Well, in summary, just thank you so much, Laurie and Sarah, for presenting your great work. The EMSC program, we take this as, this external evaluation as a part of a larger piece of us understanding the progress of the EMSC, progress and impact of the EMSC program as we continually reflect and understand and refine the direction moving forward, and reflect on also the major accomplishments of the grantees. So I just appreciate your work on this, your presentation today. Thank you so much. And I appreciate, again, all the folks on the line, who many of you, these were reports that you spent probably a lot of time on, and on additionally work that you're doing on the day-to-day to expand and improve emergency medical services for children. So thank you so much. Thank you, everybody.